So I will do that now. Any other questions for Jennifer? Okay. No other questions? You can feel free to unmute yourself or use the chat before Jennifer jumps off, and then I'll jump into some other updates from our Feeding Wisconsin network.
Thanks so much, everyone. Have a great day.
Take care.
Bye.
Bye, Jennifer.
All right. Bye, Jennifer. Okay. A few other updates from our end. So on the nutrition benefits front, as Jennifer mentioned, the public health emergency is still in effect. What we know is that it's likely this week going to be decided if it will be renewed for an additional 90 days. So I think by the 16th of March, we'll know if it'll be extended. What I've heard is that it's likely to be renewed for an additional 90 days. So that will take us into mid-July. And what that means for you all is that as long as there's a public health emergency in effect, individuals will still continue, who are receiving food share benefits or SNAP or food stamp benefits, will continue to get benefits in that emergency allotment range. So they'll continue to get a maximum benefit for their household size through the end of that public health emergency order. So we know that families, are in a different situation right now as they're getting those benefits. And we know that when the public health emergency order ends, many folks might be dropping, for a single person household, might be dropping from $250 a month to $20 a month. So we know that as individuals and their resources, as the resources that individuals have shifts with the end of that public health emergency, that's also going to be make for a different situation that they have to meet their food needs. So we anticipate an increase in participation in food pantries and emergency feeding sites once that public health emergency order goes away. Again, likely not to be until mid-July, but we'll learn more in the coming week. So like I said, with that, I'll finish up this section and then I'll jump to the question, the hand raised. With that, folks continue to receive the emergency allotments in March, meaning that they'll get at least an additional $95 of benefits each month. They'll receive either the maximum benefit for their household size, or if they were receiving that maximum benefit, they'll receive an additional $95 in benefits each month. Those will be landing on folks' Quest cards, I believe, this coming weekend. And DHS is working with organizations who have contracts to do SNAP outreach on what we're calling unwinding. How do we educate and build awareness of the end of that public health emergency and what that means for individuals receiving benefits? So I'll be sharing more information in the coming months, both flyers, graphics for social media, and so on. And I'd be very grateful if others would be able to get those out to folks that they serve to help prepare them. There's a lot of things that we're hoping folks will do. If individuals, for instance, are seniors, elderly, blind, or disabled, as noted in by DHS, if they, for instance, claim medical expenses, that can help with decreasing that blow that will come with the public health emergency order ending. So hopefully folks, instead of dropping down to $20, maybe can at least receive $60 or $90 if they have some of those things reported. So there's efforts that we're doing to try to increase the reporting of expenses to maximize benefits for households. And then on the pandemic EBT front, the first issuance of pandemic EBT just happened on March 5th. That is a program that supports students, K-12, who qualify for free or reduced price meals with the National School Lunch Program. And $7.10 is provided to the family for each day that a student was out of the classroom, whether the school was closed in this past year, this current school year, or the student was out because of COVID quarantine or exposure or such. So what we know from this first issuance, which covers benefits for the August to October period of time, is that the average benefit amount for a family who received it was just under $50. So it's substantially different than the benefit that was given out last school year, because we know that virtual learning is very different as well. So this isn't a benefit. I mean, it's a benefit that hopefully does support a family through those periods of time when a student is at home, but isn't the same amount of benefit that was especially helpful last year. So it may not impact the lines that you're seeing, folks attending a pantry on your end. The other note on the pandemic EBT front is that pre-6 pandemic EBT, so benefits for students or children who are under 6 or not yet in school, early childhood age, DHS will be submitting a proposal to Food Nutrition Services at the USDA to hopefully roll out that program to come. But that is not happening quite yet. Before I jump to a couple other updates, I see that Raymond has his hand raised. Raymond, you can feel free to unmute yourself. Raymond, are you able to unmute yourself or use the chat? There you go.
Okay, thanks very much also to join this meeting. I'm glad to hear much. Yeah, and I'm sorry being late a little bit, but the system was a bit having some problems. But I'm very glad to be participating to this meeting, and I hope things will go well. Thanks a lot.
Great, thanks. Do you have any questions for now?
Not.
Okay, well, thank you so much for joining as well.
Thanks.
All right, a couple other updates for everyone before we jump into some time for conversation. I had mentioned last meeting that we have a supplemental report to a pantry visitor survey that we conducted in 2020, a while ago now. I have that pantry visitor survey, the supplement that is looking at highlights the client's perspective of their experience with pantries. And that is now listed on our Pantry Network engagement page on our website. I don't have that, rolled out publicly. It's meant to be a document, a report for you all to review and take in as you'd like. It's a much shorter supplement, and it includes a lot of quotes from participants of that survey that we did. So I threw the link in the chat. You can go to that. That takes us to our page that provides notes and other updates of these calls. That page also, like I shared, if you see the research section on that page, the second link, the Internal Pantry Network Supplement Report, you can feel free to go to that and have a quick read if you'd like. The other update I wanted to share more on is our Hunger and Health Summit. So we will have our first in-person Hunger and Health Summit. This was a summit, a conference that we had annually pre-pandemic, but of course took a couple-year hiatus with the pandemic. That will be April 24th to the 26th. So we'll have a pre-conference gathering on the 24th at around 6:30 that Sunday night, just to welcome folks as they arrive. We'll have pizza and salad and some beverages, and just kick off our conference and allow for some networking. And then we'll have 2 full days of conference. We have announced our 2 general session presentations on the luncheon on Monday, April 25th. We'll have Katie Martin, who is the author of a 2021 book titled Reinventing Food Banks and Pantries, New Tools to End Hunger. And like I said, she'll be speaking at our first luncheon on Monday on tangible action steps and innovations, things that she's seeing from around the country to shift the way that we do our work. And then on Tuesday, April 26th, over the luncheon general session, we'll be joined by DHS's Assistant Deputy Secretary, T.R. Williams, and the new director of the new Office of Health Equity at DHS, Dr. Michelle Robinson. And they'll be presenting a session they call Food Security as a Driver of Health Equity, the role of advocacy in addressing social determinants of health. So they'll be joining us as our keynote speakers. I will share more information you can find on our summit website. I'll also throw in the chat. And registration is live for that event, so you'll find registration available. And if you are a Pantry member of Feeding America Eastern Wisconsin or Second Harvest Food Bank of Southern Wisconsin, please work directly with your food bank to register, as they are comping one registration per member pantry. So if you have any questions, you can also reach out to me, but the registration is live and we are excited to have folks join. We'll have 30 breakout sessions as well, one track being emergency food related, and a lot of great speakers, including some of you all on this call. So very much looking forward to that opportunity. And before we jump into conversation, I'm just going to share out that our next call will be on April 14th at 11 a.m. These calls will continue to be the second Thursday of every month. Before the next call, I'll be working to plan out some topics for each call and posting them on our Pantry Network webpage so that you have an opportunity to view various topics for discussion in advance. We hope that that will just help kickstart some of these conversations, although I know you all have a lot of topics that are interesting to you to discuss. So feel free to email me if you have some topics you want me to add to the calendar. I'll throw my email in the chat as well. So jumping back to the questions now that Jennifer is off, feel free to use the chat to throw in any questions or conversation. I'd love to go back to the question that Mai raised about culturally relevant food pantries. And I know that there are some specific pantries, but given this is an important topic, I'd love to also open it up to pantries that might not define themselves, as a pantry serving only a specific population, but how are you as a pantry ensuring that the foods that you are serving and providing access to are meeting the needs of those you're serving? How are you ensuring that there's culturally meaningful or dietary specific foods at your pantry? So let's start with that conversation. Mai, do you want to jump in and offer any other thoughts to kick us off? Well, I can go ahead and just open it for discussion. Then feel free to unmute yourself or use the chat. And Tammy, I see your hand raised. Feel free to jump right in.
Hi, so I wanted to mention that Feed My People is starting something that we are calling a culturally responsive food initiative, a pilot program that hopefully some of the food will arrive tomorrow is our goal. We're working specifically with a handful of partners. Melissa with WISCAP, who's on the call today, is one of those partners we're working with. We are currently targeting Latino and Hmong populations to gain a better understanding. So I should say those are the two cultures we're initially targeting because those are the highest populations of people in the counties that we serve, culture culturally specific communities that we serve. Anyways, so this initiative, we've been learning as much as we can about specific desires, traditional foods, what's more common for people that have been here, folks that have been here for multiple generations, family that have how those eating preferences have changed. And we've started sourcing some of those foods specifically. In the past, if we had foods that were specific to a particular culture, it was truly by happenstance of how food was donated to us. So this is something that's new in our part of the state. Hopefully we will be able to expand offering those foods to all of our partners in our 14 county service area. Currently, it will just be those handful of partners for this pilot to really gain a deeper understanding of how to best meet the needs of hunger with particular cultures.
Thanks, Tammy. Go ahead.
This is, yeah, I got lost a little bit. I had too many screens in there and I couldn't come back to meet. So I could hear all the words, but I just couldn't unmute myself. Anyway, I raised that question because at the Hmong Institute, we are finding ourselves doing food during the pandemic just to meet the basic needs of Hmong, Southeast Asian, Laotian, Cambodian, Tibetan families. And as the pandemic lingers around, there's, continues to be more need. And I don't see this going away soon for us. And so I'm asking that question because we also have people in other community now calling us and say, hey, can we come to Madison and get food? And I'm like, really? For a 2 hours drive, you're gonna come to us to get food? And so it's starting to, makes me wonder about, okay, how can we also partner with some of you who have large concentration of Hmong, Southeast Asian community in your community and help you, provide the culture relevant food so that way they will come to your pantry and their needs will be met. And when I say culture relevant, I'm talking about things that they will eat. It saddens me a lot when I go to low-income housing like Bayview here or something when, in the past, it doesn't happen now anymore as much, but in the past, when you give them food and you go there, they land it in the dumpster. Instead of landing in the dumpster, other family could use those food. But the culture piece of being polite and don't want to turn people down because then you'd be rude to people when they're trying to help you. Also, it's not efficient in that. So what we're doing on culture relevant is, instead of pasta, give them rice noodle, right? We have rice noodle that we eat instead of the pasta. Instead of canned food that's in beans, give them, bamboo shoots that they will eat. Rice is the number one commodity staple. And of course, it has to be the right rice. It can't be Uncle Ben's rice or the little 1 pound of certain rice. They won't eat those either. It has to be the brand that they eat. And that is mainly, the long grain jasmine rice. Seasoning, oyster sauce, chili pepper. So we're talking about foods that our families will be able to use, not cooked meat because the seasoning is not the right kind, or they cannot portion size it to feed their large families. So you give them raw meat, so then they can portion size and make it last for their large family. We have family as large as 13. And so when we talk about culturally relevant food, we're talking about basic food that they would use, that they can be creative in feeding their family during this pandemic time. And I think when a lot of other families seeing us doing this, of course, we always post on our Facebook what we give out. And so then they call us and say, yeah, can we come, to pick up food? They're from Appleton, Stevens Point, and so I'm just asking this question of how in Milwaukee as well. We have a few family, who works in Madison and comes here and want food. And I have to say no, because they don't live in our, territory. So I'm asking that question just to see, any one of you who have our population in your community, I'd be happy to have conversation about how to do that, so that way our families don't have to feel like they have to come to Madison to us to get it, even though we don't have the fund for them because they're not in our, area. So anyway.
Thank you for offering that, Mai, and for all of, I think alone just having that kind of education, I think there's a lot of assumptions that are made of, we'll just stock rice and that, but I think, like you said, making sure that it's the right kind of rice, making sure that it's, portioned in ways that make good sense, and other elements of meals are offered alongside those staples. So thank you for that. I'll jump to Melissa and then Lisa.
I think I might have lost my train of thought, and this was before Maya started talking. I just want to remind those that our TEFAP food pantry outlet, even though it's awesome, and we're doing this too, trying to get culturally specific foods in, it is something though that has to be offered to your entire population. You cannot hold it aside and say, this is only for my Spanish, Hispanic families, this is only for my Hmong families. So once you go back into setting up, client choice, where they're coming in the buildings and they're choosing it, as long as you're not labeling it as it's only specifically for that population, that anybody can choose off those tables, that's the most ideal. Right now, because of our situation, I'm doing everything outside, and I feel like I might sometimes kind of be in the wrong with this, but we have we have probably like 12 consistent. We're very rural here, so we don't have a lot of diversity, except for we do have a operation in town that hires a lot of Latino families. So I have like 12 families that are large families. So I have stacked specific stuff, and I will be stacking more once Feed My People has these other items available. But we have these bags that are set aside that I've been just throwing on the carts as I see the families, if I know that they're coming through. And at some point, I'm hoping just to be able to have everybody accustomed to some of these other food sources. If we're not client choice, I want to be able to put a bag of that specific food onto everyone's cart, just to I spread the horizon of, their palettes. I don't know, but I don't know how to do this completely without it being a civil rights area if I'm only given that specific bag on the cart that goes to my Latino family. So I'm struggling with that a little bit, but I also know that once we open up, that won't be an issue.
Thanks, Melissa. Lisa.
Mine was kind of, kind of along the same line, just saying that when we get back to like in-person shopping, that would be a lot easier. The way that we do things now with the prepackaged bags, that's based on household size, we wouldn't have room to prepackage bags for more than one type of bag for each family, for different ethnic groups within each household size. So that's one of the reasons I really want to go back to more of the in-person, because then we can have everything on the shelves and they choose what they want. And we just have to be more sensitive to getting the things that are more desired by different ethnic groups. But doing it drive-by, it really is more difficult to do that.
Point taken, Lisa. I know the last call we spoke a lot about how can we do advanced ordering, or how can we kind of do these makeshift packing of boxes. And I know that that's not possible for many folks, especially with limited volunteers, but I do think going back to a choice model offers a lot more flexibility in providing culturally meaningful foods. So hopefully that will help that effort. We have about 5 more minutes. Any other last thought from anyone they'd like to share on this topic? I feel like this is a relevant topic to continue, as I know that we're all trying to, both source product from, various cultural producers, as well as get that product to these communities. It just makes sense to support folks on both ends.
Hi, I have a special grant that we have at WISCAP for serving the Latino Hispanic communities. And we are working on opening a pantry in a neighborhood where they have a high population, and we've done ordering specific foods for them with the grant, like rices and seasonings and the kinds of beans and dried beans that they use and corns, like that kind of stuff, and servicing them out of our pantry in Sparta.
Great. Please do share with us how that goes and any tips or tricks as you move towards opening that.
Okay, thank you.
All right. Any other last thoughts? How do we better serve elders or seniors that have specific dietary needs is one thought in here. I mean, along the same lines, dietary appropriate foods. So how are we making sure that there's foods available to folks with diabetes or various health conditions to make sure that what we're feeding is not contributing to any conditions they have, but maybe even acting as a remedy for those conditions. Well, thank you all for all your thoughts today. As usual, I will post the notes to the call in our Pantry Network engagement page on our website. Here's a link directly to the notes section. I'll just put those in the link. Thank you for your thoughts and ideas. And if you have any suggestions on how to make this call more useful to you, Jennifer and I are certainly open to those ideas. We look forward to this being a space for ongoing conversation, best practice sharing, and working through challenges together. So we look forward to chatting again April 14th. And also, please do check out our Hunger and Health Summit, where we can be together and spend almost 2.5 days together to have some of these similar conversations in much more detail. So hoping that I'll see some of your faces there. Again, that's April 24th to the 26th. So take good care. Thank you all for everything that you do to feed folks in our communities across the state. Appreciate everything. Take care. Bye-bye.